just saying that what we've done at Successful Solutions is spend a terrific amount of time getting ready to assist each and every one of our clients with 4 major areas. We're going to go through and describe what that looks like in a little bit of like fly through a report and provide you samples. But moving forward, one thing is true with the healthcare reform. It's different for every company. It's different depending on what state you're from. There are different rules and laws that sometimes vary from the actual Affordable Care Act, and then there are certain things that we know for sure and others that are still yet to be determined. So given the fact that we're moving into 2014, we're going to hold these on a monthly basis and try to give everybody a general update as to what's going on, but the real emphasis is on the fact that we want to provide detailed and specific information for all of our groups on a proactive basis, and we've spent a lot of time and effort putting things together so that we have the tools to do just that. And I think you'll agree after we go through a couple of these that these tools that we've converted from a lot of the work that we've done in the past 2 years on the ACA help us to help you. And then depending on the audience, of course, if it's the human resources director or the CEO or company or the size of the company, different tools are going to be more or less important to that particular company. So the first one to go through is the healthcare reform analysis, and this one is very, very substantial. It's got probably 80 pages, and I picked just a few out to show you the kind of detail that we are going to provide for all of our groups. So the first thing I chose was a slide that we will show each company to help them understand the process and where things are headed in terms of healthcare reform and the actual law. As you can see, this covers from 2010 and goes from 2015 and beyond. And there are some different notations here. Some of these will have to do with a particular group or size group, and some may have nothing to do with it. That's why we need to make sure that you guys have all the information that is customized to your company and your situation. And that's what we're going to begin to do in the first quarter for all of our groups so that they're prepared as we move into the employer mandate portion, which takes place in 2015. The basis of this is that we want to analyze the current benefit structure. And again, keep in mind, this is not just for prospective groups that we work with, but certainly for those that we've been lucky enough to work with over the years. We want to develop a strategy that is long-term, and we want to implement products that give you and your company the best advantage and serve the needs of your associates and employees. We want to make absolutely sure that you understand the legal aspects of the law and how it relates in terms of human resources, employee benefits, and the rest, but bearing in mind that we're neither attorneys nor are we CPAs, but we do have the way to provide you with information that's on the basic level, and if you really need to drill in further and get more specifics, we can point you in the direction of legal resources as well as a CPA. And then mostly we want to find out what the process is and define a process moving forward for how everybody deals with the oncoming stuff in the ACA, whether it's paying new industry fees, changing how, for example, we have to submit census information to get quotes. All of this has been taken into account, and we're moving forward with all of our groups so that they have a roadmap of what the heck is going on, because there's been so much confusion. So, for example, on the left, you'll see that we have certain laws that are effective. On the right, you'll see where there are laws that are still pending that we're not sure about. I get questions on this one quite a bit, waiting periods over 90 days. And oftentimes, we can answer that question if you're a company that's in Arizona or Nevada. There are two different answers. And then when it comes to California, if people are aware of it, there's an Assembly Bill 1083 that requires that the carriers not have a waiting period over 60 days. So a lot of this gets really confusing if your business is not medical insurance or human resources or employee benefits. How we communicate that to you and then how that is communicated to the employees and the carriers is really the trick. The transitional reinsurance fees, a lot of folks aren't aware, but there are two different fees. One of them is a percentage of the premium, and the other one is a dollar amount of $5.25 per month per employee. Both of those are coming into play with the rates in 2014, and we can't get out of that. Having an idea of what that is going to look like and how that will impact your benefits package is something that we need to strive to get together in advance and communicate so everybody's on the same page. There are 5 major cost drivers right now, and if we break them down, there are industry fees and taxes, and you can see that PCORI is one of them and the reinsurance is another. And again, I'm flying through this stuff on purpose because there's really no need to get stuck on any one slide. We can go and we want to go through your specifics in an individual meeting. I just want to show you the sort of work product that you'll be seeing. There's expanded eligibility, a Cadillac tax that's upcoming, new benefits plan coverage, and then the employer mandate fees. And the employer mandate fees are one where a lot of people, we were ready for that going into 2014, and then there was the delay in the employer mandate fees where we obviously didn't need to focus on all of that. Some of you have turned in substantial amount of payroll records to try to get a report to figure out what those costs are going to look like. Once we were ready to deliver those, and we had delivered many of them, we come to find out, okay, there's a delay. So now it's delayed until 2015, and the message from us today to you is that the delay means that we've got to get started making a plan in early 2014 so that you're ready when that actually hits in 2015. And you can see the impact is roughly 17 to 20% in terms of cost just from these items here. But we have strategies that can take 94% of those and reduce them based on our recommendations. Now, this particular sample does have recommendations on page 16. It is based on a sample template census, but we aren't going to cover the actual specifics. There's no point in doing that in a global setting, but individually, that's the sort of thing that we want to go through on an individual basis. So the next issue is, how is the company set up and what is their objective in terms of their strategy to address and respond to healthcare reform and also to plan for healthcare reform changes? So we all need to be on the same page in terms of how you're going to budget and plan, shift employees, and ultimately create a multi-year strategy. What's the role of benefits with your recruiting and employment offers? For some companies, that's critical. For others, maybe less so. And then does your executive team or the people deciding on benefits, do they understand the challenges and the costs with healthcare reform? And then are you prepared, in the case that you're a human resources provider, are you prepared to actually keep track of and administer all of the healthcare reform changes, and do you know what those requirements on you are going to be like, and do you have the tools to have that prepared for your company? And then finally, how is it that we are going to get together and communicate, what frequency, how detailed, when there are changes? How are we going to do that together and make sure that the employees aren't completely and totally lost?